Thank you, Annette, for that introduction. I just want to check in. Can everybody see and hear me okay? If not, Annette, maybe you can let me know, but hopefully everyone can see me and see my slides. Thank you all for coming, on a Saturday morning to kind of listen to this talk and this lecture. I'm excited to have you all today. Like Annette had said, we're going to be talking about physical activity and cardio exercise. And I'm just going to be going through these slides here. If you do have questions, you can throw them in the chat. I like to keep my talks a little casual. So if you have things that you want me to discuss as we're going, feel free to put it in there, and I'll be kind of trying to take a look out for that so I can answer those questions. But we will have some time at the end too to go over more. So a little bit about me. So like Annette said, my name is Lily Pentlin. I am a clinical exercise physiologist and a health coach. I did move here from Hawaii. My family moved to San Diego last July, and we had my son last August. Yes, a new mom, and he just turned 1 this past week. So it's been pretty exciting. My husband's in the Navy, so that's what's brought us to San Diego here. And I came on to the longevity clinic down in San Diego just a couple months ago. And just to let you guys know what I offer there, I offer both personal training services, that's in person, and then I do offer health and nutrition coaching. I do that both in person and also virtually as well. Oh, are you guys not seeing the whole screen there?
I'm seeing. No, I can see it.
Oh, you can?
Yeah.
Okay, anyway. Everything looks fine. It's filling your screens.
Okay. Well, let's see again. Uh-oh, what happened?
Okay, yeah. Everything looks fine now?
Yeah.
Okay.
Yeah.
Okay, perfect. Sorry about that. All right. So what we're going to talk about today, we're going to talk about just the different types of movements. We're going to do a little review of that. And then we're going to talk about differentiating what is physical activity and what is cardiovascular exercise, and what are the differences between the two. Then we're going to kind of dive into physical activity a little bit more. We're going to talk about the guidelines. We're going to get into step counts too, and talking about what do we know about them, and are they beneficial to track, and what should you be tracking. From there, we'll switch gears and we're going to talk about cardiovascular exercise. I'm going to talk a lot about how to build a routine, where to start, and how to progress with that. And then as we go throughout the whole program, I want to talk about how to, practical applications for increasing your physical activity and cardiovascular exercise. So first, let's just go through the 4 main types of movement. So we have physical activity, and this is kind of things that you do throughout the day. We have cardiovascular activity. Again, I'm going to break this down a lot more detail in a bit here. We have strength training and balance and flexibility. So like I said, today we're going to focus on the physical activity and cardio components. Many of you probably have been part of longevity for some period of time. You've probably been in physical therapy. A lot of times in physical therapy, the focus is on regaining range of motion, it's on balance, on flexibility, and on that strength training component. Your physical therapists are giving you strength training exercises to work on. So we thought this webinar might be great to kind of talk about what is those other missing pieces, the cardio and physical activity that are still part of exercise, still part of movement, things that we should be doing, but maybe you just don't always get the opportunity to talk about them in physical therapy. All right, so let's dive into it. Let's talk about what's the difference between physical activity and cardio exercise. So there's 2 main things that differentiate something from being physical activity and cardio. And I'm going to give a couple examples. So I want you to think about a couple scenarios. One is taking your dog for a walk. And I want you to think, do you think that that is cardio exercise, or do you think that classifies as physical activity? What about carrying a bunch of heavy groceries inside after you get home from the store? What about going up a hard flight of stairs? I've heard a lot of people, it's kind of a joke, someone goes up a hard flight of stairs, they're like, okay, that's my workout of the day. And so it kind of begs the question, is that an exercise? Is that a workout, or is that something else? So 2 things will classify something as cardio or physical activity. The first is intensity, and that's how hard is the movement for you. So when you're doing that activity, if you're not feeling short of breath, if you're not feeling like your heart rate is increasing, if your body temperature hasn't really changed much, I would say that that classifies something as physical activity. So you're moving around a little bit, but you're not really seeing a huge bodily change to indicate that you're in a cardiovascular training zone. If you are feeling, okay, I'm feeling out of breath, I'm feeling like my heart rate's increasing, my blood pressure's increasing, my body temperature's increasing, that might be an indicator that that activity is cardiovascular. So that's step one, is what's the intensity of what I'm doing. Step two is how much time am I spending doing that activity? So anything that takes less than 10 minutes, no matter the intensity, will be considered physical activity. The reason being, your heart rate needs to be increased and in that training zone for a minimal of 10 minutes for it to have benefits on your cardiovascular training system. So let's go back to those examples that I gave. So climbing that hard flight of stairs or bringing in those groceries, that might fit the intensity goal, right? We might feel short of breath, our heart rate is increasing, our body temperature is increasing. It was challenging, but it probably didn't take you longer than 10 minutes to do that. And if that's the case, that would be considered physical activity. Now let's talk about that walk that I said, the casual walk with your dog. And maybe you have a smaller dog and your dog stops frequently for sniffing the ground or going to the bathroom. And so yes, maybe the walk took you longer than 10 minutes, but you didn't feel out of breath, you didn't feel your heart rate increase, you didn't feel your body temperature increase. That would also be considered physical activity and not cardiovascular exercise, okay? So both the intensity needs to be elevated and it needs to be greater than 10 minutes for us to classify something as cardiovascular exercise. So that's just, I want to kind of start with differentiating the two of those things. Now, before I get into physical activity, I like to take a moment and talk about the problem with being inactive, which is the sedentary or the sitting problem. So the average adult spends more than half the day or about 12 hours sitting. And you might think about this and think, yeah, okay, that's me. I spend a lot of time sitting, but I'm just lazy. But it's not a big deal. I just don't like getting up and I don't like moving around a lot. And you know what, actually this problem has increased for most people since 2020, just the nature of either working remotely or staying in the house more than getting out. We're spending more time being sedentary, but I don't think a lot of people think about how it's affecting their health. And really it is. Physical inactivity causes about 1.6 million deaths a year. And it's the fourth leading risk factor for global mortality. And the reason for that is being physically inactive is a risk factor for cardiovascular disease, for diabetes, for a lot of these chronic conditions that are kind of the major killers in our country. So it's something we need to start to think about. It's not just sitting, it's not just being lazy, it's something that's affecting our health. And it actually poses kind of a higher risk than smoking, hypertension, obesity, or even having high cholesterol. So we think about like, okay, if I have high cholesterol, if I have hypertension, if I'm overweight, I know those things are impacting my health, but we may not think that being lazy or sitting all the time impacts our health the same way, but it does. And there is a problem with sitting for long bouts of time. So I want to talk about something called the sedentary athlete. And that's someone that maybe you are someone that, you follow a regimented exercise routine. Every morning you exercise for 30 to 60 minutes, or sometime throughout the day, you exercise for 30 to 60 minutes, but maybe you go into work and you have a desk job and you're sitting for long periods of time, 2, 4, 6 hours on end. What the data shows us is that you still have that risk. So it's not just that, yes, you did your exercise and yes, that's important, but that long bout of sitting also contributes to our health risk. So actually sitting for longer than 4 hours in a row increases your risk for death by 50%. How many of you can think about your day and, especially maybe those that have a job where you sit, that's pretty common to sit for 4 hours at a time. And then research also shows us that if you're sitting for longer than 6 hours a day, then we start seeing risk for things like anxiety, depression. A lot of this mental health stuff is coming out of that as well. So sitting is truly a problem and we do need to do something about it. And even the data since 2020, if we think about COVID, they've actually done a lot of research. Exercise physiologists have done a lot of research on how physical inactivity has affected people getting COVID and ending up in the hospital and dying from it. They found that people that are physically active, that are actually meeting physical activity guidelines, are less likely to get COVID through community spread. It's decreased by 31%. And then they did another study in 2021 of 50,000 people, and they found that people that were inactive were twice as likely to be hospitalized, admitted to the ICU, and die. So that's kind of real data showing that, yes, it's a problem for things like heart disease, diabetes, all of this, but it's also like we see that being physically inactive drastically affected people getting COVID and ending up in the hospital for COVID. Um, so just super relevant for what we are going to be talking about today and why all of this information is important. So let's move gears now to talk about physical activity first. So let's review what physical activity is. It's anything in our day that lasts either less than 10 minutes or it just doesn't elevate our heart rate high enough for it to be counted towards cardio. So this is a lot of like household chores, how much are you on your feet throughout the day, just kind of your general activity. So it's often been determined on step counts. We've heard that quite a bit. And actually, if anybody wants to put in the chat, does anybody on this call, does anybody track steps? And if you do, what is your daily step goal? Does anybody want to share? I'm putting you on the spot now. It's okay if nobody wants to share. But a lot of people are tracking steps. It's very common. We have like our Fitbits, we have our Apple Watches, we have smart device. It's very common now to be tracking activity and using that as part of our fitness plan. It's interesting to note that the average American gets somewhere between 3,000 to 4,000 steps a day on average. Oh, my Fitbit tells me 10,000 steps is enough. Casey, thank you. So 10,000, that's a good number. We've heard that, right? Everybody's heard I should be reaching 10,000 steps a day for optimizing my health. I think that even the Fitbit will buzz. I know like the old school ones used to buzz on your wrist once you hit the 10,000 step mark. So it's interesting. We keep hearing, oh, I should hit 10,000 steps a day for physical activity, but where did that come from? And is that what we should be following? So let's talk about first, where did that come from? So what's interesting is it didn't come from any scientific background or data. What it came from in the 1960s, 1964, Tokyo was hosting the Olympics. And at that time, Japan wanted to kind of, they were really trying to work with their people on increasing their physical activity. So they were kind of taking this opportunity of having all these athletes, you know, in their country and showing off their athletic abilities to try to promote physical activity to their people. And so a company created a step tracker. It was kind of one of the first versions of a pedometer, like a pedometer that you could just wear along with you, and it would track your steps. So they came up with this device and they called it, I want to make sure, I think it's called the Manpokai. If anybody's Japanese, I'm sorry if I misspelled or misspoke that. But what it translated to was a 10,000 step meter. So what this company did is they used that as kind of their marketing campaign. So they said, we want you to wear this step tracker and your goal is 10,000 steps a day. And so this really took off. People actually really loved it. People bought this step tracker and then they used it and everybody had this goal of 10,000 steps a day. And as you know, since then, the use of pedometers and wearable devices and step trackers has gained a lot of popularity. And this 10,000 steps a day has kind of stuck. Everybody still has this idea that I should be doing 10,000 steps a day. But it's just interesting that it didn't necessarily come from research. It came from a marketing campaign where 10,000 comes from. So then that begs the question, okay, so if that didn't come from data and research, what does the data say about step counts and what should we be aiming to get? So what we've learned from most research is that your step count is affected by a lot of things, and it affects chronic diseases and conditions differently. So we're going to take a look at what are the goals for seeing risk reductions and improvements from a couple different standpoints. So let's look at all-cause mortality first. So all-cause mortality is kind of just looking at from a basic general standpoint, how does increasing my step count decrease my risk for developing chronic disease? And what they found was, yes, as your step count increases, your health risk decreases, but they actually found that that leveled off right around 7,500 steps a day. So what they showed was there wasn't a real clear benefit between people that were averaging 7,500 steps a day and 10,000 steps a day. So a little bit less than what maybe this recommendation is for. But what's even more important there is they found that even increasing by 1,000 steps a day helps to reduce your risk by over 40%. So, and you're going to hear me say this a couple times, but I think people have this idea that I should be hitting 10,000 steps a day. But if I don't hit 10,000 steps a day, I'm not seeing health benefits. But that's just not the truth. Increasing by just small amounts has a great impact. So it's okay that maybe you're not at 10,000 steps, but if you're even able to do 1,000 steps more, that helps you quite a bit. When they looked at cardiovascular disease, they kind of saw a little bit of the same thing. They saw, yes, your risk for cardiovascular disease decreases as your step count increases. But again, it leveled off right around that 7,500 mark, and they didn't see a significant difference between 7,500 and 10,000. But what was interesting about cardiovascular disease is they did see a big difference between people that averaged less than 5,000 and people that averaged over 5,000. People that averaged less than 5,000 were the highest risk for developing cardiovascular disease. So if that's something that, say you have a family history of cardiovascular disease, or if that's something you're concerned with, then 5,000 might be a good marker for you to kind of be an indicator. Okay, I want to make sure I'm getting beyond that, because I know that's kind of where the risk for cardiovascular disease lies. And then let's look at something like osteoarthritis or joint damage. And this also, I think, in the same category, we can classify people that are recovering maybe from surgeries, if you've had like a recent bone joint surgery. And maybe 10,000 steps a day is very unrealistic, right? For someone that has a lot of joint pain, joint damage. And they actually found 3,000 to 5,000 steps does help those with osteoarthritis or joint damage to help with the pain and both improve their mobility. So again, if you're kind of in that category, maybe you're averaging maybe just 1,000 steps a day because you're in a lot of pain and discomfort, but maybe you could have a goal of something like 3,000 to 5,000. And that has been shown to have, a lot of great impacts on your joints. And then we look at frailty. So if you think, elderly population, if you have a high risk for balance concerns, things like that, again, maybe 10,000 steps is way too much for that population group. And they found 3,000 to 4,000 steps a day, again, kind of a good range for people that are in that category. And same thing, even by adding just 1,000 steps a day, if you're someone that barely is moving around, is only getting 1,000, maybe 2,000 steps, if you can increase by just 1,000, it can really help to improve bone health. And lastly, I want to talk about obesity, because obesity numbers are going to be the highest as far as what the recommendations are for step counts. And they did find in this category that higher step counts, 7,500 to 9,500, tend to be the best for those that are looking to lose weight. And so thinking about this and thinking about, like these marketing campaigns for like Fitbit and Apple Watch and all of these things, the majority of people that start a fitness program, one of the biggest goals is weight loss. So I think this is where this idea of 10,000 steps is really stuck, right? Is because if you have a goal of weight loss, getting closer to that 10,000 step mark would probably be the most appropriate. Actually, the American College of Sports Medicine recommends for people trying to lose weight to try to aim for 10 to 15,000 steps a day. So quite a bit more. So again, I think that's kind of where the popularity of 10,000 steps a day has landed, and why a lot of people are still aiming for that. But I think it's important to know that for most individuals, like maximal benefits are usually between 6,000 and 8,000 steps a day, not necessarily at that 10,000 mark. So the moral of the story is health benefits can be seen just by increasing your daily step count from wherever you are. So if you're someone that is not near that 10,000 mark right now, just increasing by 1,000 steps a day can have a really big impact. Now, I would like to also say, if you're someone that's constantly averaging over 10,000, I'm not telling you to decrease your activity. I wouldn't tell anybody to do that. If that is coming easily to you, if that is motivating and that's working for your goals, absolutely keep doing that. But I think that people have a hard line of thinking that I need to hit 10,000 steps a day or I'm not going to see any sort of health benefits. And that's just not the truth. So let's look at just some pros and cons for maybe whether it's valuable for you to use step counts or not. So what's some pros? Well, it's easy to measure. Like I said, a lot of devices, watches, things like that, measure it, and it gives you instant feedback throughout the day. You can look down at your watch or your phone and you can know exactly where you are. For some people, it's super motivating. I have clients that love this and they get really excited about hitting their goals. And it's easy to set goals, right? And it's easy to physically track. And obviously the data supports that it does reduce risk for many chronic conditions. So for people in that category, it might be a really great thing to utilize. But what's some cons? I think one of the biggest cons is it doesn't accurately reflect all types of physical activity. So say you're someone that likes to use a recumbent bike, or you like to bicycle, or you like to swim or do some of these activities. Your step tracker is probably not going to pick that up as physical activity, and your step count might be lower. And it's not because you weren't active, it's just because you weren't doing a walking type of modality. So for those people, it just might not be a good reflection of what you're actually doing. For some people, like I had mentioned before, you might be aiming for an inappropriate goal or target. If you're someone that has severe joint damage, if you're someone that's very elderly at risk for balance, maybe like 10,000 steps is not the goal, and that could be detrimental. It may cause discouragement for some. So every person is different. If it really like ruins your day that you're not hitting your step count, it's not really a good way for you to track your physical activity. And lastly, it doesn't reflect whether that sedentary time was broken up. Like I had mentioned before with a sedentary athlete, you can go for a 5-mile run in the morning and then sit all day long. And we already talked about why that's not a great thing either. We need to break up that sedentary time. So let's talk about physical activity recommendations. So I think about it like a pyramid. We start at the bottom of the pyramid as far as where do we start, and then we work our way up. So first, just move more. Think about those times where you're sitting for longer than 2 or 3 hours at a time. How can you break apart those long hours? If you work remotely, maybe if you're on a Zoom call like this, you could do it standing. If you have to take phone calls frequently, maybe you could walk around while you're doing that. It's just a couple ideas of how you can break apart the long periods of sitting. The next is habit change. How can you start making small choices that will increase that just your general daily activity? These are things like taking the stairs instead of the elevator, parking farther away and walking into the store. It sounds silly and small, but those things really do add up. The next would be, okay, maybe it is appropriate for you to set a step count goal and aim to hit an appropriate target as long as you know what's most appropriate for you. And then last is consistency. This is most important across the board with any type of movement. You know, you can make a change. You can decide, okay, I'm going to stand for Zoom calls and phone calls. And if you only do it for a week, we're not going to see the benefits for it long term. So whatever that you decide to do, you need to be doing it consistently for it to have that impact on your health. So I'm going to switch gears here and talk about cardiovascular exercise. I did want to take a quick pause, and does anybody have questions right now about anything I've talked about thus far? And you can put it in the chat. Give it a moment. If not, I will move on to cardiovascular exercise. Okay, I don't see anything, so I'm going to go on, but feel free as we're going. If you have anything you think of, feel free to put it in the chat. Okay, so let's talk first benefits of cardio. And I know that many of you guys know that there are benefits to cardiovascular exercise, and some of these might not come as a shock. Some of these you might not know. Obviously, we improve our heart efficiency, our heart health when we're doing cardiovascular exercise. It benefits your blood pressure. It benefits your oxygen carrying capacity of the blood. It helps with your lipid panel, so decreasing triglycerides, which is your blood fat. It helps with blood sugars if you're prone to diabetes. Helps to improve your metabolism, prevents bone loss. It increases your HDL cholesterol. What's interesting, kind of fun fact here, HDL is your good cholesterol. Cardio is the only thing that can increase that number. And if you have a HDL cholesterol high enough, it's actually considered a negative risk factor towards heart disease. So one of the great reasons for why we should perform cardio. And I also like to add in that from a mental health perspective, cardiovascular exercise does help reduce stress and depression. So many of you may have experienced that if you started an exercise routine in the past 2 years, that it's helped with coping skills and managing your mental health. So just quick review, what is cardiovascular exercise? So now we're talking about activities that last either longer than 10 minutes and also are at an elevated intensity. So you're feeling short of breath, heart rate is increasing, body temperature is increasing. So what are some examples? And these are just a few. There's plenty of things that you can do for cardio, but jogging, running, brisk walking, incline walking, cycling, elliptical, swimming, dance fitness, Zumba, like any type of those aerobic classes, hiking. Those are all examples of what cardiovascular exercise is. All right, so let's get into some recommendations. And I know this slide seems like a little bit chaotic, but I'm going to break it down for you. So I'm going to talk about something called the FIT principle. And exercise professionals, exercise physiologists, we use this to prescribe exercise to someone. And it's an acronym. So it stands for frequency, intensity, time, and type. So frequency is how often should you be doing a certain type of exercise. So you'll see on this board, I have beginner, and then I have someone that's more intermediate advanced, and there is different recommendations for those folks. And if you're kind of looking at this and you're thinking, I don't really know where I am, I do some cardio, I don't know if I'm beginner or intermediate advanced, I usually use the rule of threes with people. So if you have been doing cardiovascular exercise for a minimal of 30 minutes, 3 times a week for the past 3 months, I would say that you've developed consistency with cardiovascular exercise, and you may be in the intermediate or advanced category. If you've been inconsistent, or maybe you haven't done at least 3 days a week, 30 minutes, I would say better to stick to that beginner category until you can develop that solid routine, and then you might be able to advance. So when we look at frequency, for someone that's a beginner, maybe 3 to 5 days a week would be a good place to start. For someone that's intermediate advanced, they could do 5 to even up to 7 days a week and sustain that. As far as intensity, I'm not going to spend a lot of time right here, because the next couple slides we're going to break apart intensity and how to kind of calculate that, or how to look at that. But there's an RPE chart. I'm going to be talking about that, and we're also going to talk about calculating your heart rate zones. Next is time. How long should you spend doing exercise? If you're a beginner, I recommend around 20 to 30 minutes. Now, we said it has to be a minimal of 10 minutes for it to count towards cardiovascular exercise. So if you're very deconditioned, or if you're very new to exercise, it's okay to start with even just 10 minutes. And you could break that apart in a day. So you could do 10 minutes in the morning and 10 minutes at night, and then that would equal that 20 minutes, okay? So eventually we do want to be able to, add minutes to our time and build up to being able to tolerate 20 to 30 minutes. But at the beginning, 10 minutes might be just fine. Obviously, for someone more intermediate advanced, 30 to 60 minutes might be something they can sustain. For the purposes of this presentation, I don't recommend that anybody does cardiovascular exercise longer than 60 minutes on any given day. The caveat to that is there are some that are training for certain endurance specific goals where their endurance activity is going to last longer than 60 minutes. You think about like half marathon or marathon runners, of course, their training programs are going to look different, and they are going to have days. But if we're just trying to exercise from a general health standpoint, I would say no longer than 60 minutes on any given day. And the last is type of exercise. And the good news is there's no recommendations for both beginner, intermediate, advanced. I say find something that you somewhat like to do. You don't have to love it, but if you somewhat like doing it and you find it enjoyable, you'll be far more consistent with it. So if you absolutely hate the treadmill, and I tell you, you have to be on the treadmill to see benefits, you're not going to see benefits because you're not going to do it. You're going to find every reason not to do it. So try to find something that you somewhat enjoy. Okay, so let's talk about those intensities and how do we determine whether we're in our cardiovascular training zone and whether what the exercise we're doing is appropriate. So first, I'm going to talk about something called the RPE scale. It's called the rated perceived exertion. So this is how hard do you feel you're working when you're doing any activity. It's very relative to you, all right? So no one else can answer this for you. It's not a speed on the treadmill. It's not, a certain pace or anything like that. It's how hard do you feel you're working. The scale starts at 6 and it goes to 20. The intensity of a 6 is you just rolled out of bed and you're turning off your alarm clock. Okay, that's the intensity of a 6. So definitely not something that you should be experiencing when you're doing exercise. A 20 is maximal, the hardest thing that you've ever done in your life that you can't maintain. Imagine you're carrying 2 heavy suitcases with broken wheels and you're sprinting through the airport about to miss your plane. Okay, that type of like intense activity that we're not supposed to be meant to maintain. For cardiovascular exercise, we really kind of want to be in the middle range there. You see that green zone between 12 and 16 where it's somewhat hard, kind of getting into that hard zone. That would be the target range for someone that's performing cardiovascular exercise. And sometimes I do get the question, why is the scale 6 to 20 when it would be so much easier just to have a scale of 1 to 10? The reason why the RPE scale is 6 to 20 is it's a clinical based scale and they use it based on heart rate. So theoretically, if you were to add a 0 to the end of those numbers, that would be your heart rate. So you think 6, 60, that's a very low resting heart rate. 2200, well, that's a pretty high maximal heart rate. So that's where the 6 to 20 comes from, if you're kind of wondering why it's a little confusing there. But like we said, with the beginners, even like 11 to 13 might be a good range for someone just starting off. That's going to feel slightly out of breath, heart rate's increasing, those things. For someone that's more advanced, they're going to be able to get to those 15, 16, maybe even 17 marks, and they're going to be able to maintain that once you've developed that cardio efficiency. Okay, the next way and one last, like before I move on, I love using the RPE scale with people to see how hard something feels for them, because you're not always going to have access to technology and equipment to give you feedback. max. So, you know, like we're going to talk about heart rate, and I think heart rate ranges are great, but what if your watch dies during a workout, or what if you don't have access to something? It's good to create this mind-body connection of knowing the intensity of what I'm doing is appropriate. That way you're not always constantly having to rely on technology to tell you whether your exercise is, you're in the appropriate range. But that being said, let's talk about calculating heart rate. So this is just a basic method. There's kind of some more advanced ones out there, but this is an easy one, I think, for most people to get. So first, to calculate your heart rate, you need to know what your estimated maximal heart rate would be. And the easiest way to do that is taking 220 minus your age, okay? So if you do that, that number is your estimated maximal heart rate. And so when we train, we think about working at a percentage of that max. So for someone that's a beginner, we said 65 to 85% of the max would be probably appropriate. So you would take that number that you got, your 220 minus your age, you'd multiply that by 0.65 and multiply it by 0.85, and there you go. You have your target heart rate range. For someone more intermediate advanced, they can sustain higher heart rates. So they could actually even train somewhere between 80 to 94% of your max for some individuals. So same thing, you would take that same equation, 220 minus your age, get that estimated max, and then you multiply it by 0.8 and then 0.94, and now you have that target range. Just a quick note too, again, heart rate ranges can be great and they can be beneficial for some, but I just like to throw it out that there is certain medications, beta blockers, some people might be on for controlling their high blood pressure. And if you are one of those individuals, when you're exercising, you actually are going to have a lowered heart rate. It's called a blunted response based on the medication that you're taking. So for people that are on certain medications, that's another reason why target heart rate ranges aren't always the best, just because your medication is doing its job, but it is kind of interfering with what your heart rates, your outputs of your heart rates when you're exercising. So if anybody has questions about that, I can talk more in a bit here. Okay. So this, I like to put this in because I think this is another question too. People say, well, what about HIIT training? What about interval training? Where does that fall into this kind of prescription or what we should be doing? So first, let's just talk about the differences. So steady state is where we increase our heart rate. We kind of stay at the same pace, or we stay at the same intensity for whatever it is, 20, 30, 40 minutes, and then we cool down. In interval training, we're talking about the intensity varying. You're going to see really high intensities and then low intensities, and high intensities and low intensities. So then you see there the RPE range for someone in steady state, they're going to kind of stay in that moderate green zone. For someone doing interval training, you're going to go from kind of right at the end of that green zone all the way up in that red zone, and then coming back and forth, back and forth, back and forth. When you're doing interval training, you will be seeing higher percentages of your heart rate because you're working very intensely, and then you kind of lower your heart rate as you recover, push, recover, push, recover, versus someone doing steady state cardio. Your heart rate's going to vary, but it's going to kind of stay in that same range the whole time. For steady state, we're working on build time and duration. So those sessions, like we mentioned, we're trying to get up to 20, 30, 40 plus minutes. For interval training, those sessions are always going to be shorter. They're considered vigorous exercise. So think something like 20 to 30 minutes would be more appropriate for interval training. And then what's the recommendation? So if I'm doing steady state cardio, how many minutes a week should I be aiming for? The minimal is 150 minutes a week of this moderate exercise. 300 is kind of, if you're, again, you've got other types of goals, weight loss, maybe we might talk about more than that. For interval training or vigorous exercise, the recommendations is 75 to 100 minutes a week. So then whenever I show this, people are like, well, hey, if I only have to do 75 minutes of interval training and I have to do 150 minutes of steady state training, I'm just going to do interval training. That's like more bang for your buck. And the thing about that is, yes, that is true. But the thing about it is, if you do not have a foundation of cardiovascular fitness, interval training is considered intermediate and advanced. So I wouldn't want to prescribe or have anybody start interval training until they've conditioned themselves to be able to do steady state exercise. Okay. So step one, if you're brand new, we're going to talk about, what my recommendations are for cardio in the next slide here. But if you're brand new to cardio, I would say, just work on building your time and tolerance first. And then once you feel like you've got 3 months, it's 3 days a week, then you might be appropriate to start to include interval training, because interval training is very taxing on the body and it's not necessarily appropriate for someone that's brand new to cardio. Okay, so then what's the building blocks? So how do we start a cardiovascular training routine? And you know, what are my recommendations as far as the next steps? So I just mentioned this. The first thing is to build time. Okay, so if you're brand new, you want to be able to tolerate 20 to 30 minutes for at least 3 days a week, even starting at that 10-minute minimum if you have to. Okay. So at first, I would say that is your only goal. Don't worry about the intensity. Don't worry about anything else. Just worry about building your time and tolerance to doing 20 to 30 minutes just till you feel short of breath. You're feeling like that heart rate's coming up a little bit. Okay. Once you've kind of conquered that and you feel comfortable there, the next thing is to work on the intensity. So maybe it's still pretty light. You've gotten up to 3 days a week, 30 minutes, but the intensity's still been pretty light. Well, now let's work on, can we increase that a little bit? Either by just looking at like that RPE range of how do I feel? Can I start to feel like it's more intense? Or, you know, if you're using the heart rate range, maybe working at a little bit of a higher heart rate. Next is frequency. So, okay, I've got the time, I've got the intensity. Now, maybe that's when I'm ready to start adding additional days, or this might be adding additional time too. And so maybe I've been doing 20-minute sessions this whole time. Maybe I'm ready to bump it up to 30-minute sessions, or maybe I've been doing 3 days a week. Maybe I'm ready to add that fourth day. And then last, just like with physical activity, it's consistency. Because we can be doing, you know, really great with our cardiovascular training routine. You can have a really great week. You can have a really great 2 weeks. But then if you take a month off, we're starting to lose all that progress that we made. So consistency is the most important. So especially when you're setting goals, you want to set something that you can achieve and then build upon that, because that's kind of just going to reinforce for yourself the habit of creating a cardiovascular training routine. So this is kind of, I'm getting to the end, wrapping up here. If anybody is interested in learning more about step counts or wants to read more about that article I had spoken about, as far as the different ranges and what we know about the studies that have done on step counts, that's there. And then the American College of Sports Medicine is where all the guidelines come for as far as prescribing exercise and how many days a week, the FIT principle that I had been discussing before. And with that, I believe I'm going to turn it over to Annette for some remarks, and then we will open the floor for discussion, for questions.